first photo, I have a chiropractor who is responsible for treating patients with poor body alignment. He is also responsible for directing patient care, administrating patient care, and staying within his scope of practice. To treat his patients, he first makes an evaluation by asking them questions on how they feel, where their pain is, and any recent activities they have been up to. Afterwards, he then can make a diagnosis or prognosis to create a treatment plan. For this patient, she had acute pain in her lower back. To relax her muscles, he advised one of the assistants to put electrostimulants. Other relaxation methods are heat, ice, and stretches. After a couple of minutes, he then came back in, the assistant took off the electrostimulants and gave advice to the patient on how to decrease strain on her back. After these advice, he then provided pressure on the area of pain and made chiropractic adjustments here. After the chiropractic adjustments, he then gave more advice, interacted with her to gain her trust, and then made another date so the process can continue again. For my second photo, I have a nephrologist, Dr. Russo, who spent many years in school to be able to get into his profession. His top priority as a nephrologist is to prevent patients ever going to a dialysis center by educating them on how to keep a healthy kidney. However, if there ever is a problem with their kidney and they need a transplant, they're advised to go see Dr. Russo and be sent to a dialysis center. Here at the dialysis center, a patient is connected to a dialyzer, which acts as a kidney by taking in blood, filtering it out, and then bringing it back to them. Dr. Russo's priority here is to ask patient questions and then make sure to make adjustments to the dialyzer, which can be seen here. In this picture, however, Dr. Russo first asks questions on how the patient's family is doing and how he's been the couple weeks before. After gaining his trust, he then asks medical questions on his health and any changes, so he can make adjustments to the dialyzer if needed. However, the patient's conditions were stable and he was able to move on to the next patient. For my last photo, I had a podiatrist who specializes in foot and ankle care. He treats injuries like fractures and sprains, toenail fungus, and infections, and many more. In this picture, our patient was diabetic, which means they have numbness in their feet. Diabetic patients are increased for infection due to the numbness when they cannot feel a cut, which can lead to infection and lose a toe. In this picture, Dr. Palladino was able to catch an infection on the patient's toenail, which can be seen being buffed out here. Due to this, the patient was able to walk out with his toe and was given antibiotics and another date so we could check on it